to the lack of PPEs and sidelining of some health workers who are not classified as frontliners. The statement issued by Mr. Ansah, 2 health service workers died from COVID-19 just this week alone. He'll be joining us via Zoom to talk a little bit more about their statement, in which they list a number of things that they expect government to do. Let's just go through the statement that they released earlier today. Well, in that statement, they talk about the Ghana Health Service. They talk about the need for government to send PPEs or to share PPEs with all health workers. They talk about mass testing and vaccination when the vaccines become available here in Ghana. And then they talk about constantly reviewing the measures that we've put in place. As I said, Mr. Ansah will be joining us on Zoom so we can talk a little bit more about the concerns that they're raising and how exactly they envisage that those concerns will be met shortly. Let me take a few of your messages while we wait for Mr. Ansah to join us there. This one says, my name is Osman Dawood. Okay, my name is Osman Dawood. It says, attention at Komfo Anokye Teaching Hospital is due to internal politics. Those in key positions are serving the interests of their political fathers. Due to this, the staff are gagged and cannot express their inner feelings. It's quite a long message. I have others, so I'll just leave it there. And he says the staff infected with COVID-19 have also not been paid insurance packages. This is certainly something that we're still looking into and investigating. We'll bring more of that subsequently as well. This one says the Ministry of Health and Enterprise. Okay, this is an allegation that I cannot substantiate. I will not go into it at this point. And this one says that the blame game on the surge of COVID-19 cases should be put on the blame should be put on our leaders because they have failed us. How can huge cases just vanish? When we were approaching the election, you can see people chanting and dancing, following them during their campaigns. It will surprise you the words that you will receive from someone when you tell them to put on their face masks. Keep your messages coming. I still have a lot of them. I'll try and read some, but we're waiting for Mr. Ansah to join us. But here is a statement that they put out today, in which they list a number of things that they expect government of Ghana to do. Their concern, as we told you earlier, is that about 10 of their members have been killed, and more than 200 of them have been infected and still receiving treatment. So that sort of sums up what they have, I think, in the first and the second paragraph. Let's move to the next paragraph and take a look. It's pretty long. This one says, so it talks about the situation, and then it says, in such a gloomy picture, health workers at the various health facilities have become the first agents to suffer from the rage of the pandemic. Health services workers, union members, and the entire health workforce continue to risk their lives. And he goes on to make the point that currently over 200 members have contracted the virus and 10 of them have died. Let's move on and look at the bullet points that they made about their expectations of government. Okay, so there it is. It says that in view of these, which is the fact that members have been infected and some have died, the union herewith profess the following recommendation. One, there should be adequate, appropriate and timely supply of PPEs to all health workers in all health facilities. In doing this, government must put in place all the occupational safety and health measures and protocols. Also, the government, they say, must ensure all health workers are tested and also consider them first when vaccinations and treatments become available. And this is a point indeed that government has indicated they will do. And then it goes on to say that the government, through its health agencies, should do constant reviews, like I said earlier. Also, they want government to honor promises of paying compensations to health workers. So the issue of compensation there as well in the message that I just read to you, to health workers who get infected or those who die out of COVID-19 in the line of duty. They say that though there is education and constant update from government, the union has observed that the increasing disregard of safety protocols by the public gives credence to the fact that there is a need for intensified public education, especially letting the public know that the variant emerging moves faster and is 70% more transmissible. As a complement to public education, the government must continue enforcing the protocols aggressively. Security agencies should ensure strict enforcement safety protocols without fear or favor. On the issue of reopening of schools, the health workers union say that they think it will be a better decision if government adopts a consistent random testing to ensure that all asymptomatic children in schools are also identified and treated to reduce the infection in schools. It says there should be constant monitoring to ensure that both teachers and students are adhering to the protocol, something that the Ghana Education Service says it was doing. And then it says that the general public is entreated to adhere to the safety protocols. Well, Ms. Ansa, Franklin Ansa is joining me on phone right now. Ms. Ansa, thank you for your time. Good afternoon. You raised a number of issues which already have been addressed by government, talking about mass testing and mass vaccination. We've seen a statement from the Ghana Health Service that essentially talks about mass testing. Are you aware of these?
Yes. Thank you for calling. The union is aware of the mass testing, but it says everybody who walks in. What about the school children who will not walk in?
Okay.
What we said in our statement was that randomly, government should test the students and the teachers so that it will inform us what is happening in the schools.
Okay.
We also talked about vaccination. Yes, we are aware of what government is doing. All that we are saying is, if the vaccines come in, health workers must be vaccinated first, because we are going to take care of the people. Our health should be taken care of.
I think that over the weekend, the former Deputy Health Minister, Dr. Koboy, indicated that health workers are on the priority list. They are first, I think, among the group of firsts to be inoculated when the vaccines actually get in.
Yes.
Or was this not communicated at the union level, and that perhaps it was something that was said out there in the media, but it wasn't?
Whatever he said has not been communicated to the union and has not been communicated to the health workers. And so, well, even if he has said it, and we are also requesting, it is just to remind government that whatever he has said, he also stands by his word.
Okay. And so the point you're making is that you think that we should have random testing in the schools so that you, the health workers, will be better informed and you know how to manage the situation with them, correct?
As we speak, all the treatment centers are full, and we don't want the situation that will get out of hand. There are a lot of people who are walking around. They are asymptomatic. They are not showing any signs of the disease, yet they are carrying it around. If random testing is not done, and it happens in a school where nobody gets to know, and the situation gets out of hand in that school, children of about 200, 300, a lot of people being infested, who is going to take care of them? It's still have workers.
Okay.
So it is better we take care of it now than the situation gets out of hand.
I'm personally happy that most of the issues that you raised today, we heard at the press conference, seem to have been addressed. But there is something very serious in your statement about your members, that 10 of them have been killed and 200 of them have been infected. Tell us a little bit about this.
My sister, I'm telling you that it is over 200. If we have gathered information about 200 people contracting the disease, you should know that because of the stigma associated with it. There are some members who contracted the disease and will not want anybody to know. And for that matter, it is that serious. Even this week, as I'm speaking, 2 of our members have died to COVID. And we also don't have the full information of the people who have died, but at least those who have reported to us, more than 10.
So there's a possibility that you actually have a lot more casualties and a lot more infections.
This is members of the health services workers union. We have doctors who have died who are not part of us. We have nurses who have died who are not part of us. So health workers who have died, more than 10.
That's a pretty serious situation. It brings us back to the issue of PPEs. It was one of the biggest things we had to deal with previously. And now that we're dealing with a more, in your statement, according to your statement, a 70%, a more dreadful variant, if we can confirm that, which you say has a 70% rate of infection. I don't know, what are you internally, and I know that government should provide this, but are you providing any support to your members internally to at least deal with the situation as we put pressure on governments to do what it has to do?
Definitely, yes. The union is also trying to help. When the situation started, the union bought some PPEs and sent to our members. We bought some sanitizers, we bought some face masks, and we also got in touch with organizations that made donations to the union, and we give it to our members. But you know, most of these things are consumable. They give it to you today, the next day it is used up, and it needs to be replenished. Government is doing a lot. Yes, we know government is doing a lot. But trust me, there is still more room for improvement.
Have you been in touch with the sector ministry, and have they told you anything about PPEs?
Yes, we have had meetings with the sector ministry, even up to the presidency level. They still assure us that they're going to step up, but it is still not enough. Like I'm saying, they are doing their best. If you give me face mask as a health worker, I'm supposed to use, whilst I'm at work, I'm supposed to use about 3 face masks in a day, disposable one. And so even if you give me a box which contains 50, how many days am I going to use this and it is used up? But the ministry said, yes, we have supplied enough. Enough up to when? This is where the challenge is.
So more PPEs, more PPEs are needed.
The treatment centers have more PPEs because those places, we know the situation is bad. But the situation is equally bad in the cheap compounds and in the facilities that are not earmarked as treatment centers. That is where people will walk in until they are tested positive. And that is where it is more dangerous. But this is where we have the shortage.
Yeah, it's a very difficult situation. But your colleagues who are 200 of them, more than 200 of them, you say, who are down with the infection, are they responding positively?
Most of them have recovered.
Great, great. Mr. Franklin, if there's anything else you want to add, do that for me in like 30 seconds if you can. Otherwise,
thank you. All that we want to tell our members is that they should stay focused. They should take care of the sick, but they should also take care of themselves. Because the situation is not getting better anytime soon. Thank you.
Thank you very much. Franklin Ansah there, he's speaking for the Health Services Workers Union. They say that over 200 of their members have contracted COVID-19. 10 of them have died. 2 of them just 2 weeks ago. Now, the African Union says it has received significant support from telecoms giant MTN to help it undertake its COVID-19 project. We'll talk a little bit about that one when we return from this break. Just stay with us. And now let's do African Union. It says that it has received significant support from telecoms giant MTN to help it undertake its planned COVID-19 vaccination soon. The African Center for